Every single morning you wake up with your tongue stuck to the roof of your mouth, your throat feels like sandpaper. You desperately reach for water before you can even think straight. Sound familiar? You're not alone. This happens to approximately 22% of people worldwide, according to research published in medical databases. But here's what most people don't realize. That parched, sticky feeling when you wake up isn't just annoying. It's your body waving a red flag, and ignoring it could lead to tooth decay, gum disease, and even increase your risk of heart problems. Yes, you heard that right, heart problems. Today, we're diving deep into the 4 root causes of morning dry mouth that doctors see most often, and more importantly, the simple nighttime fixes that actually work. Because once you understand what's happening while you sleep, you can wake up feeling normal again. Root cause. Number 1. You're breathing through your mouth all night. Let's start with the biggest culprit, mouth breathing during sleep. And no, this isn't just about snoring. When you breathe through your mouth instead of your nose at night, you're essentially turning your mouth into a desert. Research published in the journal PMC reveals that mouth breathing causes significantly more water loss than breathing through your nostrils. In fact, a study on patients with obstructive sleep apnea found that those who breathed with their mouth open lost approximately 5.5% of their plasma volume during sleep. That's similar to the dehydration you'd experience after running a marathon. But why does this happen? When air flows directly through your open mouth for hours, it evaporates the protective saliva coating your oral tissues. A study from the National Institutes of Health showed that approximately 74% of sleep apnea patients report xerostomia. That's the medical term for dry mouth, upon waking. The severity increases with how long your mouth stays open. Now, the concerning part, this isn't just uncomfortable. According to research from the American Dental Association, chronic mouth breathing creates prolonged inflammation that can lead to gum disease, bad breath, and tooth decay. And here's the kicker. Evidence shows that inflammation caused by oral disease can actually increase your risk of heart disease. Root cause. Number 2. Your medications are stealing your saliva. If you take any medications regularly, listen closely. Over 100 prescription and over-the-counter medications list dry mouth as a side effect, according to the American Academy of Oral Medicine. The most common culprits? Antihistamines for allergies, antidepressants, blood pressure medications, decongestants, and pain relievers. A study published in the Archives of Oral Biology found that patients taking tricyclic antidepressants experienced a 58% reduction in saliva flow compared to those not on medication. Even newer antidepressants called SSRIs caused a 32% reduction. Here's what's happening. These medications affect your sympathetic nervous system, which controls saliva production. According to research from Cleveland Clinic, they essentially tell your salivary glands to slow down or stop producing saliva altogether. And the more medications you take, the worse it gets. Studies show that people taking more than 4 daily prescription medications have significantly higher rates of dry mouth. The StatPearls medical database confirms that medication side effects are the #1 cause of xerostomia, surpassing even autoimmune diseases like Sjogren's syndrome. Root cause. Number 3. You're going to bed dehydrated. This one seems obvious, but it's more nuanced than you think. Dehydration doesn't just happen from not drinking enough water during the day. According to the National Health Service in the UK, dehydration is one of the most common causes of waking up with dry mouth. But here's what many people miss. Your body naturally becomes mildly dehydrated during sleep because you're not taking in any fluids for 6-8 hours. The Sleep Foundation explains that this nighttime dehydration is compounded if you've consumed diuretic substances before bed. What are diuretics? Caffeine and alcohol. Both make you urinate more frequently, pulling water out of your body. A study published in medical journals found that alcohol consumption before bed not only dehydrates you, but also relaxes the muscles in your throat, making you more likely to breathe through your mouth, creating a double whammy effect. Add to this excessive sweating from your sleep environment being too warm, and your body prioritizes its most critical functions, decreasing saliva production as a non-essential process. Root cause. Number 4. Your bedroom. Air is too dry. The fourth root cause is something you probably never considered: environmental humidity, or rather, the lack of it. Research from Mayo Clinic indicates that indoor heating systems during winter can drop humidity levels to 20–30%, well below the recommended 40–60% range. When you're breathing dry air all night, whether through your nose or mouth, it dries out your nasal passages and throat tissues. According to the Sleep Foundation, dry indoor air is a significant contributor to morning dry mouth, especially for people who sleep with heating or air conditioning running. The dry air essentially wicks moisture away from your oral tissues faster than your body can replace it. Johns Hopkins Medicine confirms that using a humidifier, especially in your sleeping area at night, can provide significant relief by maintaining proper moisture levels in the air you breathe. The simple nighttime fixes that actually work. Now for the good news, you can fix this. Here are science-backed solutions that work. Fix number 1. Train yourself to breathe through your nose. If mouth breathing is your issue, you need to address nasal congestion first. The American College of Allergy, Asthma and Immunology recommends treating allergies that cause chronic congestion. Use nasal strips to open airways, or try sleeping on your side instead of your back. A study published in PMC on mouth taping for mild sleep apnea. Patients showed that when properly used in appropriate candidates, it reduced symptoms significantly. However, experts warn this should only be attempted under medical guidance and never, if you have severe nasal obstruction. The risk of suffocation is real. The safer approach. Address the underlying cause. See an ENT specialist if you have structural issues like a deviated septum or enlarged adenoids. Fix number 2. Talk to your doctor about medication timing or alternatives. If medications are the culprit, don't stop taking them. That could be dangerous. Instead, according to research from the Merck Manual, you can modify when you take them. Taking medications in the morning instead of at night can reduce nighttime dry mouth symptoms. Your doctor might also switch you to alternatives with fewer dry mouth effects. For example, SSRI antidepressants cause less dry mouth than tricyclic antidepressants, according to studies published in dental journals. Fix number 3. Hydrate strategically. Throughout the day and night. Keep a glass of water on your nightstand. According to the Sleep Foundation, sipping water before bed and when you wake during the night provides immediate relief. More importantly, hydrate consistently throughout the day. Avoid caffeine and alcohol in the hours before bed. Both are diuretics that worsen nighttime dehydration. Fix number 4. Use a bedroom humidifier. Research from Johns Hopkins Medicine confirms that using a humidifier in your bedroom can significantly alleviate dry mouth symptoms. Set it to maintain 30–50% humidity. You can verify this with an inexpensive hygrometer. Cool mist humidifiers work year-round and are safer for homes with children and pets. Just remember to clean it regularly to prevent mold and bacteria growth. Bonus. Fix. Chew. Sugar-free? Gum with xylitol. Here's a bonus tip backed by solid science. Chewing sugar-free gum containing xylitol before bed can help. Studies published in PMC show that chewing gum increases saliva flow dramatically, from a resting rate of 0.4–0.5 ml per minute to approximately 5 to 6 milliliter per minute initially. The American Dental Association confirms that xylitol specifically stimulates saliva production and has antibacterial properties that protect your teeth. According to research, the saliva-stimulating effects can last up to 2 hours. The bottom line: waking up with a dry mouth isn't just uncomfortable, it's your body telling you something needs to change. Whether it's mouth breathing, medications, dehydration, or dry air in your bedroom, now you know the root causes and the fixes. If dry mouth persists despite these changes, or if you're experiencing other symptoms like difficulty swallowing or bad breath that won't go away, see your doctor or dentist. Sometimes dry mouth signals underlying conditions like diabetes or autoimmune diseases that need medical attention. Your mouth does incredible work while you sleep, repairing tissues, fighting bacteria, protecting your teeth. Give it the moisture it needs to do its job. If this video helped you understand why you wake up parched and what to do about it, please share it with someone who needs this information. Hit that like button and subscribe to the Pain Story channel for more health content that cuts through the noise and gives you real, science-backed answers.